What does a traffic cop have anything to do with your office? I'm going to tell you. We have a position in our offices, and we teach our clients this position, which we call traffic cop. It's a slang word basically for somebody who directs traffic in the office to make sure patients efficiently get around where they need to go to so that they get everything done and then they're out of the office in a timely manner. And you think, okay, is it that important? We were on the phone today with a bunch of clients and having this this was the discussion, because at AMI, one of the positions that we heavily recommend a office has is a traffic cop, okay? And so the whole conversation was centered around, does it really matter to have a traffic cop? Can't the staff tell people where to go? Let me tell you how the discussion went, because I thought it was a pretty spirited discussion, which I thought was great. A lot of the clients chimed in on different things, different hacks that they did to make sure that the patients got moved around. But at the end of the day, they said, we are in the business of healthcare. There's a business portion of it, which means we're not nonprofits, right? It's a business that should be profitable, okay? And it's healthcare, which means we're delivering services to a patient to help them get better. So that means that in the process of delivering healthcare to patients to help them get better, there's an actual business aspect to it. And I said, if you look at the business aspect to it, okay, the reason for the traffic cop is that all patients, when they come into your offices, and I'll tell you specifically in an AMI office, we have very specific steps that when the patient's examination is worked up and everything is worked up, and the patient is given their treatment plan is never cookie cutter. The AMI system helps to actually process patients at a high volume and never have to order cookie cutter care. Our systems actually handle the chaos that you could have 100 patients coming in a week, 3 times a week at 300 visits, okay? Imagine 100 patients coming in 3 times a week, all of them with completely different treatment plans, and having them come in and your staff seamlessly deliver these treatment plans. So normally what happens in a chiropractic office, because we were the same way, patients would come in, remember this was back in the 90s, hot pack, e-stim, adjustment. So we had what was called the therapy room. And in the therapy room, I want to say there was probably 10 tables set up, and there was hot pack machines and electric stim machines. All patients went in there first, they got their hot pack e-stim, they moved out the other door, they went over to the adjusting area. I think there were 3 adjusting tables, and Mike was over at the adjusting tables. And they literally would move from one station to the next, they'd get adjusted, they'd come out, they'd check in, they'd say bye-bye, and they'd leave. And every patient came in and did the same thing. Now granted, the adjustment they got, that was definitely individualized. It was specialized to whatever it was. But all the treatment surrounding the adjustment was exactly the same thing. And then what happened was we decided we wanted to add a little bit of rehab in there. So we had a little bit of rehab, but it was exactly the same. So everybody went into the hot pack e-stim station, then they went over to the stretching, a little bit of exercise, they went over to the adjusting tables, and out they went. We could easily see 750 visits a week and move people through that. How hard was that, right? Not hard at all. Especially when you had Mike, who was adjusting, and then some of the other chiros who were adjusting. They were phenomenal adjusters, and that's where they got the adjustment was not cookie cutter. But then when we actually started getting bigger and offering more services, it was like, boom, chaos. It was like our heads went, and it was like, we cannot be ordering different care because the staff is going, who's getting what? It was chaos. So we had to go, all right, how do we move from this cookie cutter system into being able to offer, let's say 10 different things, okay? So let's say the hot pack e-stim, because that was still around. Remember the ultrasound? So we were doing ultrasounds, okay? We were doing a little bit of bracing. We were doing some rehabilitation. We were doing chiropractic care. We had a intersegmental traction table, a decompression table. We couldn't put everybody through every single station. They would be there for hours, so we couldn't do that. And so now when the doctors were examining the patients and they were getting a little more individualized, it was causing this chaos in the office. So this is where, at least with AMI, our systems, which are now the AMI systems, we have figured out how to have 100 people come in, have a workup, and order. Each one of them has different type of care. So if you imagine you might have 15 different modalities in your office, and each one of them has a different type of care, okay? And we have a system where they come in that everybody knows what they're supposed to do. So I'm getting to the traffic cop part here, so you can bear with me here, okay? So in that system, when the patient arrives, you still got to get them to the right station. Think about it, there could be 15 stations or 15 places in the office. You still got to get them to the right places, okay? So you can plan all you want for the day. If 15 people walk in the door at the same time, somebody has to know where everybody's supposed to go. So you think of New York City, and the traffic is coming from all directions. Anybody who's been to New York City, right? The horns are blaring, people are trying to cross the street, and they have traffic cops in New York City, right? They'll go down there and they'll let so many cars through, they'll tell people to stop, they'll tell them to move over there, right? It's the same concept. So we have the systems which preps an office for this chaos, right? But with the traffic cop knows exactly, you could, just like a traffic cop in New York City, when you come in, you go over and sends the patients off where they're supposed to go. And then once they're at the first station, the teams at the stations know how to move them on to the next station. In the AMI systems, we give you that. But the point I'm getting to here is, without a traffic cop, you have a choice. You either put in a cookie cutter system, which means everybody gets the same thing. And having talked to enough clients, and I've talked to thousands of doctors who simply they've bought many machines, but they seem to settle on the same 2 or 3 things, and the adjustment is always part of it, right? And they just do the same things. They either buy a new machine because this machine is going to increase their income, right? And they buy a new machine and they start using it for a while, but it causes chaos because the whole staff is used to doing these 3 things. It causes chaos, and the machine gets pushed off to the side and gathers dust. And then meanwhile, there's like a graveyard of machines back there that had good intentions, but they're gathering dust. And that is because the office is not capable of giving individualized care. See, at any volume. You can certainly see 50 patients a week. Think about this. If you're a doctor that wants to spend a half an hour with every patient and give total individualized care, and you work 40 hours a week, do the math on it, you can see 80 patients. Half an hour each, individualized care, right? Totally can do it. You are the bottleneck on that practice, right? You either work more hours or that's it. You're never going to see any more than those patients, and you're never going to produce more than that half an hour can produce. So with the AMI system, it's a beautiful set of systems that when you put them in your office, the staff is processing them through, and you now have 100 patients, right? Each one of them on an individualized care plan, that the day is prepped, and the traffic cop ensures that they go and get everything. And this is where, if you want to scale your business and you want to make more money, you don't have to work any more hours for patients. What you need to do is you need to be able to have what we call a large toolbox, which is 6, 7, 8, 9 things to offer, which I can almost guarantee you, they're probably sitting in your back room already gathering dust. If you pulled them out and dusted them off and tried to implement them all, you'd go into chaos. We have these few simple systems that you put into place. And I'm gonna tell you, our RGP program, which is our revenue growth program, is a 6-month program that we double your income in those 6 months. And we don't even ask you to go buy anything else. We just send you in the back room and say, pull some of your stuff out, let's dust it off. We're gonna show you a process that you can use all of your stuff. And what that does is, the money you invested in those machines now can begin to make you money. But with the traffic cop, what the traffic cop does is this. If you have 100 people coming in, you have 100 people coming in, they're coming in 3 times a week, so that's 300 visits. All 100 of them have something different to do, okay? So all 100 of these people, okay, one has 5 things to do, one has 4, one has 3, one has 6, whatever it is, right? They're all different. If they get into the office, and the office, it starts to get chaotic, and they drop to what I call the irreducible minimum, which is they get adjusted, and the 1 or 2 things that the staff is used to, everything else is missed. And if that is missed, that is opportunity that day that is gone. I say gone forever. We wake up every single morning. Every single morning we get a brand new day to produce something that day. At the end of the day, that day is gone. The rest of your life, gone. That production, gone. Like I say this to doctors all the time. Every day a day happens that you live in chaos, you're losing money. Because the money that doctors don't realize that they're losing is the money that they never realized. They never actually produced. So look at it this way. You don't have a traffic cop. You normally do 3 things with everybody. You decide you buy a machine, you decide to dust off 2 machines, you put them out there. You're telling them, everybody now, because you can't do all 5 things on people because people are not going to stay that long. So you mix it up a little bit, okay, that kind of thing. And then your staff forgets to deliver the stuff, can't remember, what's this person supposed to get? Nobody knows, it's kind of chaos, right? You've actually ordered things for the patient, which would have increased your income. So you have these machines that can increase your income, but you're not using these machines because it causes chaos in your office. So you have a machine, every day that machine sits there unused is opportunity gone forever. And for a doctor, why I use this example is, a doctor who say brings in $1 million a year to their practice, I can tell you 100% that you probably could have brought in an extra 30% of income, but it's production that you totally missed because of the chaos in your office. And if you offer a lot of services, if you don't have a traffic cop that every patient that comes in says, go here, and not only that, but the traffic cop has the list. The AMI teaches you exactly how to do this, has the list. They know when Mary Smith comes in, Mary Smith isn't leaving without these two things, these extra things. Mr. Smith is not leaving without these things. They know, they check off, they send them to the rooms, everything is done. All opportunity is captured for that day. And so I can tell you this, when I worked in the hospital, and I was a physical therapist, a monthly report would come down because all of the PTs, we all worked 8 hours a day, right? We were there 8.5 hours, we had a half hour for lunch, we were there 8 hours a day. We were expected to pump out so many units. We were supposed to see 2 patients an hour, right? So if you imagine you've got whatever that is, 4 units an hour, 8 times 4 is 32 units, I think it's right, 32, whatever. But we supposed to see 2 patients. And so every PT was expected to pump out those units. If you did not put those units out, there was a conversation had with you. Because the hospitals know when they hire a staff member, that staff member is supposed to output so much. And they put the patients in front of them, and the staff member is supposed to do the work. So what would happen is, if we would go down to get a patient, and the patient wasn't ready, we better darn sure find another patient and start treating that patient. Or there was going to be a conversation. If they discovered that we were sitting at the nurse's station waiting 15, 30 minutes for a patient because they were in the bathroom, we had a list, we were to go get another patient and treat them. And there was definitely tough conversations that were had in that room with some of the PTs, because the PTs felt like they were being pushed, that they were waiting for the patient, that they were impeding patient care. The hospital, where I started this off with, is the business of healthcare. Hospital systems know that they're in the business of healthcare. They know every day they have an opportunity that day to actually treat so many people with the manpower they have and so many services in the hospital, and they watch every line item and they maximize it. The mistake I see with doctors' offices is they drop down to their 2 or 3 items that they love, yet they buy a bunch of stuff because they think it's going to work, and it gathers dust. So with our RGP program, I'm going to tell you this. Simple program, it's a 6-month program, doesn't have to take you that long. It could take you 8, 12 weeks. A lot of guys do it 8 and 12 weeks, okay? We're going to have you dust off some of that equipment, put in 6 simple forms with a beautiful flow that we're going to double your income. Check it out.